What is rheumatoid arthritis? Rheumatoid arthritis RA is a chronic inflammatory and autoimmune disease. This means that your immune system, which normally protects your body from infection, mistakenly attacks your own healthy tissues. In RA, the primary target of this attack is the synovium, which is the lining of the membranes that surround your joints. This attack causes inflammation, which leads to thickening of the synovium, swelling, pain, and stiffness in and around the joints. Eventual damage to the cartilage and bone within the joint, leading to joint deformity and loss of function. RA is a systemic disease, meaning it can affect more than just the joints. It can also impact other body systems and organs, including the skin, eyes, lungs, heart, and blood vessels. Key differences from osteoarthritis. It's important to distinguish RA from osteoarthritis, OA, the more common wear and tear arthritis. Feature: rheumatoid arthritis, RA. Cause: autoimmune disease. Symmetry: often symmetrical, affects both sides of the body, for example, both wrists. Morning stiffness: lasts longer than 30 minutes. Onset: can occur at any age, typically 30 to 60. Other symptoms can include fatigue, fever, and malaise. Osteoarthritis, OA. Cause: mechanical wear and tear. Symmetry: often asymmetrical. Morning stiffness: lasts less than 30 minutes. Onset: usually occurs later in life. Other symptoms, primarily a joint disease. Symptoms of rheumatoid arthritis. Symptoms can vary in severity and may come and go in periods called flares, when disease is active, and remission, when symptoms are minimal. Joint-related symptoms: pain and aching in more than one joint. Stiffness, especially significant morning stiffness that can last for an hour or more. Tenderness and swelling in the affected joints. Symmetrical pattern: if one wrist is affected, the other one is often too. Most commonly affects the small joints of the hands, wrists, and feet, but can also affect larger joints like knees, ankles, elbows, and shoulders. Systemic, whole body symptoms: fatigue, often severe and debilitating. Low-grade fever. Loss of appetite and weight loss. General feeling of being unwell, malaise. Rheumatoid nodules. Firm lumps that grow under the skin, often near joints like the elbow. Causes and risk factors. The exact cause of RA is unknown, but it's believed to be a combination of factors. Genetics. Certain genes, such as the HLA-DRB1 gene, can make you more susceptible to developing RA. A family history of RA increases your risk. Environmental triggers. An infection from a virus or bacteria, or physical or emotional trauma may trigger the disease in genetically susceptible people. Hormones. RA is 2 to 3 times more common in women than men, suggesting hormones may play a role. Smoking. This is a major risk factor for developing RA and can make the disease more severe. Obesity. Being overweight or obese can increase the risk of developing RA. Diagnosis. Diagnosing RA involves several steps as there is no single definitive test. A rheumatologist, a doctor specializing in arthritis, will use medical history and physical exam. The doctor will ask about your symptoms and examine your joints for swelling, warmth, tenderness, and range of motion. Blood tests. Rheumatoid factor, RF, an antibody present in about 80% of people with RA. However, it can also be present in people without RA. Anti-CCP, anti-cyclic citrulated peptide, a more specific antibody for RA, making it a very useful diagnostic tool. ESR, erythrocyte sedimentation rate, and CRP, C-reactive protein. These are general markers of inflammation in the body. Imaging tests. X-rays used to monitor the progression of joint damage, erosions, over time. They may be normal in the early stages. MRI and ultrasound. More sensitive than X-rays and can detect joint inflammation and damage earlier. Treatment. There is no cure for RA, but early and aggressive treatment can achieve remission and prevent joint damage and disability. The goals of treatment are to stop inflammation, achieve remission, relieve symptoms, prevent joint and organ damage, and improve physical function and overall well-being. Medications. DMARDs, disease-modifying anti-rheumatic drugs. These are the cornerstone of RA treatment. They slow the progression of the disease and save joints from permanent damage. Methotrexate is the most common first-line DMARD. Biologics. A newer class of DMARDs that are more targeted drugs that block specific parts of the immune system that cause inflammation. Examples include TNF inhibitors like Humira, Enbrel, and Remicade. JAK inhibitors, a new class of DMARDs that are taken as oral pills and work by blocking specific inflammation pathways. Corticosteroids, like prednisone, powerful anti-inflammatory drugs that provide rapid symptom relief. They're typically used to control flares, but are tapered off due to long-term side effects. NSAIDs, non-steroidal anti-inflammatory drugs, over-the-counter, like ibuprofen, or prescription drugs that can help with pain and inflammation, but do not slow the disease process. Therapy and lifestyle. Physical therapy helps maintain joint flexibility, strength, and range of motion. Occupational therapy teaches you how to protect your joints and perform daily activities more easily using adaptive tools. Exercise. Regular, low-impact exercise like swimming, walking, and Tai Chi is crucial for maintaining muscle strength and joint mobility. Diet. An anti-inflammatory diet like the Mediterranean diet, rich in fruits, vegetables, whole grains, and omega-3 fatty acids, may help manage symptoms. Rest. Balancing activity with rest is key to managing the fatigue and pain of RA. Surgery. In cases of severe joint damage, surgery, such as joint replacement, especially for hips and knees, may be an option to restore function and relieve pain. When to see a doctor. You should see a doctor if you have persistent joint pain and swelling, stiffness that lasts for more than 30 minutes in the morning, symptoms in multiple joints, especially if they are symmetrical. Early diagnosis and treatment are critical to preventing long-term damage and disability. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition.